We will start by discussing the handheld nebulizer. This device is indicated for a patient who is not able to use an inhaler, such as an MDI or DPI. The one we will be demonstrating today is an Aeroclips nebulizer, which can be set to breath actuated or on a continuous flow. First, we will show how to assemble the device. Begin by squeezing the medication into the cup of the nebulizer. For example, if we were using mucomist, in this device it would help break up thick secretions, making it easier for the patient to cough out sputum. When screwing on the top, be careful not to touch the inside of the nebulizer so you do not contaminate it. Next, attach the mouthpiece to the nebulizer. Then attach the tubing to the bottom of the nebulizer. Turn the flow meter on the wall to 8 liters per minute before attaching the end of the tubing to the oxygen outlet on the wall. To make sure the medication is being nebulized properly, set the device to a continuous flow and observe the mist. If a good mist is not being produced, check your tubing connections and ensure the device is correctly put together with all the pieces. The nebulizer can be set to continuous or breath actuated with a mouthpiece. If your patient is not able to hold the nebulizer and mouthpiece to his or her mouth, you can attach a mask to the nebulizer. However, when the nebulizer is set to breath-actuated mode with a mouthpiece, the patient gets the most medication and none is being wasted. Now we will demonstrate how to set up a large volume nebulizer on a patient with a trach collar. Large volume nebulizers are often used to humidify dry inspired gases to patients whose upper airways are being bypassed, such as patients with trach collars. When using a large volume nebulizer, it is also beneficial to the patient to heat the incoming gas. To set up a large volume nebulizer, you first obtain the pre-filled sterile water bottle and attach the nebulizer head to the top of the water bottle. Screw the nebulizer head to the flow meter on the wall. Attach one end to the large bore tubing into the opening on the nebulizer and the other end to the patient's trach collar. Place a drain bag at the lowest point of the tubing to collect the condensation that will be produced, to prevent aspiration of fluid and infection. Before placing the trach collar on the patient, set the flow to 15 liters per minute and observe the mist coming out from your device. Attach the trach collar securely around the patient's neck, adjusting for comfort. Another common aerosol therapy is an MDI, or metered dose inhaler. This device is used for the delivery of respiratory medications such as bronchodilators, anticholinergics, and corticosteroids. To properly use an MDI, you first shake the MDI before removing the cap. If you have not used your medication for a while, prime your MDI by releasing a dose away from yourself. To ensure the patient is receiving the desired dose of medication, attach an anti-static spacer to the end of your MDI. This device will hold the medication in the chamber to easily be inhaled when the patient is ready to take their slow, deep breath in. This attachment is beneficial for people who have a hard time with the coordination of using an MDI, and can also help prevent oral thrush when inhaling a corticosteroid. Place the end of the spacer in your mouth and release a dose of medication by pushing the medication down. Instruct the patient to take a slow, deep breath in when they are ready and hold it in for better deposition of the medication. If taking a short-acting bronchodilator, instruct the patient to wait a minute before taking the next dose. There is no need to wait if using another type of medication. If the patient has taken a corticosteroid, instruct them to rinse their mouth with water and spit it out to prevent oral thrush from occurring. The last aerosol therapy we will discuss is a DPI, or dry powder inhaler. The difference between a DPI and MDI is that in a DPI, your breath is the propellant, which takes the medication to your lungs. Patients who have a weak inspiratory effort should not use these devices. To use a DPI, first, open the top of the device and place a pill in the pill holder. Close the mouthpiece over the pill and push the bottom on the side of the device once to puncture the pill. Instruct the patient to take a quick, deep breath in to ensure the powder reaches their lungs. If the patient has taken a corticosteroid in their DPI, make sure they rinse their mouth with water and spit it out to prevent oral thrush. Some hazards and side effects of aerosol therapy to patients include adverse reactions to medication, such as tachycardia and heart palpitations, bronchospasm, infections, especially with nebulizers since they can be easily contaminated with bacteria, and eye irritation if the patient is using a face mask. The respiratory therapist can also experience side effects from exposure to secondhand aerosol drugs, which can lead to occupational asthma and possibly infection if the proper precautions are not taken while delivering therapies.